So here we are, ladies and gentlemen, back for another episode of Meet Our Community, the Hispanic business community here in Orange County. Powered by the Orange County Hispanic Chamber of Commerce and Orange County's only community radio station, OC Talk Radio. Streaming live from our studios here at the University of California, Irvine with John Gutierrez. Just getting ready there. Let's bring you on. How about that?
Welcome, everybody, again to our community podcast show powered by the Orange County Hispanic Chamber of Commerce. I'm your host, Senior Vice President here, John Gutierrez. Thank you, Paul Roberts, for having us again at your beautiful OC Talk Radio studios.
The beautiful orange studio, and your guest is perfectly color coordinated.
Yes.
Perfect matching color.
We have a special guest today, Miriam Ramos, CEO, founder of Mint Health Insurance. Making Medicare clear is something we're going to talk about today. Thank you for being here, Miriam.
Such pleasure, John. Good morning to you and all of our listeners. Thank you for having me on today. It's a pleasure to be here.
Well, we're excited to share some good information here. But first and foremost, I just want to make sure, again, due to Hispanic Heritage Month, we want to thank today our Hispanic Heritage Month podcast sponsor, which is being brought to you by our friends at Farmers and Merchants Bank. For 116 years, zero names have ever changed. The only merger we've had was combining one century with another. Here today, here tomorrow. Think safe, think Farmers and Merchant Bank. So thank you, Farmers Merchant Bank, for sponsoring us and supporting our chamber and supporting Hispanic Heritage Month. We really appreciate that. Miriam, I'm excited to have you on our show because I know last year you all supported our annual toy drive. And I think you guys had a good time, right? Would you say?
We had an amazing time. If there's something that you are very well known for, is throwing an amazing event. And the toy drive was nothing shy of it. We were very happy to be there to support you and the community, to give back to the community. And I was so happy I was able to finally meet you there and continue to work with the chamber. Thank you for all of your support. And I really hope that many of our listeners are able to contribute. Start getting ready. It'll be December 7th. So put it on your calendars.
That's right. Our annual toy drive will be December 7th, which is the end of your healthcare enrollment that you said, right?
That is correct. Actually, thank you for that. The annual election period is coming up. Okay. It runs from October 15th, and it ends on a very special day for a couple of reasons. December 7th not only signifies the end of the Medicare annual election period, but it also gives you time to sign up and participate in the toy drive.
Yes.
And it is also my husband's birthday.
Okay.
He's the president of the company. So we like to say we were born for this industry.
Shout out to the husband.
Shout out.
Can I ask one question just to clarify? Because I'm of the age, we're talking about Medicare insurance. If you're over 55 and you have Medicare, you have once a year to pick your plan. If you don't, you're stuck with them for the whole year, right?
Pretty much. So actually, you must be 65 and over.
65, I'm sorry. Yes,
correct. Or if you are under 65, you must have a disability for over 24 months. And also for individuals that have end-stage renal disease or ALS, those also have the opportunity to enroll into Medicare at a younger age. Now, for those individuals that are 65 and over, or all of the current Medicare eligibles, if they do not make any changes during this annual election period, which once again runs from October 15th, it ends December 7th, then yes, they are pretty much stuck there for the next year, unless there are any special election periods. And we can get into that. It's part of our seminar where we educate you as to what other times of the year you will be able to make a change.
So how do you pick a company? That's all my question here today. Because you were asking me beforehand, I just sort of rolled over who I had. My wife just picked somebody that they recommend. I don't think we put a lot of effort or thought into comparing plans. There was something that just sort of said, I guess I'll just do this one because everybody I know is doing it.
And that happens quite often. So that's why we encourage you to reach out to us and allow us to give you a comparison of your current plan and plans that are available for you. A lot of times, like you say, we end up in a health plan by default. Oh, right. Somebody had it, I'll call. Seems like they're having a good time with it. They're taking care of their bills. But you all have specific needs. You all take different prescriptions, right? So actually,
different doctors maybe you need or something.
Exactly, yeah. Different networks. So this is why it is so important to connect with your local agent somebody that will guide you through not just finding the plan that fits your specific needs, but also review your medications and ensure that your providers will be part of the plan that you choose.
Well, we'll get back to some of that shortly here because it's very important we share more of that. But one of the things we like to do on our show is get to know
Tell me.
our special guests, right? And the reason why is because we often have listeners that are part of our chamber, like our youth chamber and other members of ours, who want to know your journey and just how did you get to this point? Obviously, you're CEO, founder with your husband of this business, right? And we just want to share a little bit about how did you get into this industry? First and foremost, where did you grow up, if you don't mind us asking? And tell us a little bit about you and your husband and your family.
Actually, thank you for asking. Celebrating the Hispanic Heritage Month, I am a proud Mexican from the city of Guadalajara, state of Jalisco. Very happy to have actually, it's a funny story. My husband, back then boyfriend, came to support me when I came out in Señorita Fiestas Patrias in the city of Santa Ana about 15 years ago or so.
We won't say the years. Yes, okay.
So
what is the Fiesta Patrias for everybody? I know what it is, but for others listening, it's a celebration, Hispanic Heritage Month, right?
That is correct. Mm-hmm. Yes, and usually during this special Señoritas Fiestas Patrias, you have 27 representatives representing each state of the country in Mexico. And
you were representing Guadalajara?
I was representing Jalisco.
Jalisco,
yes,
okay.
Very proudly. And so we just had tons of fun with the city, and I'm so glad to be back in here. You asked me a little bit more about my family. I'm happily married. We just celebrated our 13th year anniversary this past September. Also
congratulations.
Part
nice.
of the Hispanic Heritage Time.
Yes.
And we have two beautiful children. Mateos is now 10 years old, and my daughter Aaliyah is 7 years old. So
that's awesome. And it's great for people to know that, hey, you can have a business as a husband and wife, and be entrepreneurs, right? And start a business and work together and be successful together, right? My wife and I, we're a perfect example of that. We've been together 18, 19 years.
Congratulations to you as well.
Thank you. And the same thing, right? We own a business, our hospice company, and we work together, and it's very normal. And a lot of people will ask, right? One thing, what is it like to work together, husband and wife? And we're like, what's the big deal, right? It's not a big deal.
It's not, as long as you identify your roles, right?
Exactly.
Keep them clear and make sure that we all become accountable for what we're supposed to do. In this case, I am very happy that Albert, my husband, and now president of Mint Health Insurance Agency, came on board just a year ago.
Okay.
He is actually the one that introduced me to Medicare back in 2010. And I would see him come home from work super happy and very well rewarded, just in both senses, financially and also in that he was giving back to the community. So if you may ask, what do? We go out to people's homes and we help them find the plan that will save money for them on their prescriptions or on things that they're looking for in regards to their Medicare benefits. And so I thought, hey, how do I get into that? He showed me the ropes, and sooner than later, I became an independent agent. I actually worked for CareMore, which is a plan that was here in Orange County. And Albert continued his journey with Medicare at Anthem Blue Cross. He also worked for Alignment, so he has lots of corporate knowledge. And while that was happening, I was out in the community doing what I do best. What is that? Helping, enrolling, educating, and bringing the right plans to the individuals that we service. So just about a year ago, Albert decided to say goodbye to corporate America in that sense and join Mint Health Insurance. Ever since then, we've tripled the company, and we're doing fantastic, and we're super happy to be able to be here and to continue to support.
Which, by the way, next week, Wednesday, from 4 to 7 p.m., they'll be having a ribbon cutting grand opening at their new office. And I know you're saying about 5:30 will be the ribbon cutting, right?
That is correct. Yes.
Free event.
Absolutely. And we invite everybody. It's we'll actually be putting a registration link on our Instagram and Facebook after the podcast.
Wait, you're saying you want Hispanics to register and
I
actually
know.
RSVP?
I know it's not the norm, but those that
You
can,
said it,
great.
not me.
Actually, you said it. But Anybody's welcome. Friends, family.
You know, if I show up, I'm bringing 10 people with me and only 3 of us registered, right?
I am sure. And trust me, I'm already getting those text messages from some of our members. So it's open to members. It's open to other individuals that would like to learn what we do. It's open to the community. It's free. There will be food. There will be cocktails.
In the city of?
City of Menifee.
Okay.
So even though it's not in your backyard here in Orange County, you may ask, well, what brings you to want to work with the Orange County Hispanic
OC,
Chamber?
The OC.
Well, guess what? This is where I started.
Yes.
This is where I started, like I said, in Santa Ana doing Medicare. And we speak Spanish. So it's like we have
What's dear to your
members
heart,
out
right?
here.
Yes.
Absolutely. So I want to continue to give back. And this is how I was so fortunate to find you and connect with you, see everything that you do for your members at the chamber and for the community. We couldn't be happier. Thank you so much for your support.
Oh, no, thank you. Thank you. And that's what it's about, right? It's about collaboration. It's about providing support and resources in the community.
So Menifee is where? Menifee is, I know it's out there somewhere.
Menifee is actually in the Inland Empire. So it's
Yes.
about an hour away from the OC.
And what's
I
the
wouldn't-
closest to? Menifee is like...
Close to Temecula.
Temecula, that's what I
Yes.
was thinking.
Yes.
okay.
It's actually before you get to Temecula,
That
right?
is correct.
Yes, you drive by it. I know where Menifee is because we used to live in Lake Elsinore when we first got married, and we bought a home out there.
Oh,
and I know you got Murrieta and Menifee out there, and Wildemar, I think, is it?
Correct.
And others, right, out
Yes,
there.
and they're growing.
It's
These cities
booming.
are growing.
It really is booming. I mean, I was just talking to one of our new members who's a real estate agent out in that area, and she was featuring a home out in that area, and I was shocked. It was like $700,000, you know?
Oh, yeah.
And I remember when my wife and I bought a home out there, I want to say whatever it was, 18 years ago, 19 years ago, it was like 200,000,
Absolutely.
180 or something, 200.
Yeah.
So to see the homes at 700, it goes to show that it's really booming out there. It's growing, right?
It sure is.
And it's important to get to know that area. I think it's great. We go to Temecula wineries out there, right? Some people like going to the Pachangas
Yes.
Casino, which is out in that area. So there's a lot going on.
entertainment. There's
Yeah.
a lot going on, definitely.
Yeah.
But there's definitely a grand opening going on next
Yes.
Wednesday from 4 to 7. Once again, everybody's invited. And yes, we will put up a registration link for those that would like to see their names and get it checked off and get a nice price, door prize.
Yes.
So I encourage you
Wait,
to register.
you have like swag stuff you're giving
We
away?
do, and it's
I
like-
had an idea. I knew you were going to do that, the swag bag, you know?
Of course. Of course. It's going to be a whole event.
Is it like the first 50 people, the first 20?
It's
like,
the first 70. I think I'm going to make it the first 65 because 65 is a number with Medicare, right? Remember,
Oh.
65. If you're turning 65 anytime soon, you want to call us and you want to know how to get ready for Medicare. It's very confusing, so allow us to make it clear.
I think the best way to put it is if you have, like most of us, I'm 47 years old, we have a parent, a loved one, right? A mom, a dad who is around that age group, right? 65, 70, whatever it may be. My Uncle Paul over here, he's 80 years old. You know,
least.
Paul Roberts
At
in the
least.
studio here.
If people only knew the grief I have to put up to produce this show, but I only knew.
Me and Paul like to give each other a hard time. But, if you have anybody who's in that age range, it's important that they get informed, right? That they get that education, that resource as far as what benefits are important to them.
100%.
Everybody has a different need, right? Or
That's
want.
correct. Yes.
Some people have, issues with vision. Some people have issues with, whatever it is, different diagnosis, right?
Correct.
ALS,
I'll tell you one of the
Parkinson.
things I could never figure out. Maybe she can answer this today. I just talked to a couple of people kind of random. Again, I had full disclosure, I had Blue Cross for years when I just paid for my own health insurance. It was okay. Seemed a good plan, so I rolled it over to their Medicare Advantage plan. And like most of these Medicare Advantage plans are all free, and you think, wow, what's the big deal? And all of a sudden, you still have to pay for Medicare.
That is
coverage,
correct.
Which shocked me. I still have to pay something. Free isn't free. There's still a cost. But I didn't understand what the difference is if I stayed on Medicare and used their plans, or if I went to one of these Medicare Advantage plans where they're tempting you saying it's free. I guess I was stuck with their network. And if I ever needed a special doctor, maybe that doctor doesn't exist in their network, or the doctor I wanted to see. And I can't suddenly switch back or something. It was very confusing to me. You had to make a choice, and I sort of flipped a coin.
Well, here's the thing, Paul. just like you have all those questions, which
Yeah.
on a 30-minute show, we can't answer all of them.
Right.
Correct.
It's really difficult because I've been in healthcare 25 years, right? We own a hospice company. And even when I mention Medicare and Medi-Cal, people are like, oh, I thought they were the same.
No.
And then they're like, what is Medicaid? And, that's totally something different, right? Even though it's
100%.
similar to Medi-Cal, right? But I think Medicaid is like LA and Medi-Cal is like a Southern.
Actually,
Yes.
no. Medicaid is Medi-Cal.
Medi-Cal,
it's
right?
just that California is
Yes.
always special, and they decided to
Yes.
call it
The
Medi-Cal.
feds do Medicaid.
Exactly.
All of the United States does Medicaid,
Yeah.
Right. And
but
then
we call it Medi-Cal here in the
Exactly.
state of
the
California.
California version of it.
To
right.
answer your question, and very hopefully short
Yeah.
span here. Yes, when you qualify for Medicare and you think it's all good now, I'm going to enroll into a Medicare Advantage plan, like you said, that has no monthly premium. Remember, guys, this is so important that we check your zip code because benefits do change and vary based on your zip code. So once you join a Medicare Advantage plan, which most of them are 0 monthly premium in Southern California, it doesn't mean that's where it ends. Like you said, you still have to pay your Part B premium. So little basics, Medicare Part A only covers 80% of hospital. Medicare Part B only covers 80% of medical bills. This is when you get Part C, which is the Medicare Advantage. It's 0 monthly premium, but you
Right.
still have to pay for Part B. And it already includes Part D, which is for prescription drugs.
But
Okay?
you could stay with Medicaid.
This bundles it
or
all.
Medi-Cal and something. You don't have to go to one of these Advantage plans, but the Advantages doesn't cost you anything if you go to one of these Advantage plans.
Correct, but we'll talk about Medicaid maybe at a different.
Yeah.
I guess my
Show.
point is somebody needs to talk to somebody. I didn't have anybody to talk to, and I
Well,
just
I'm
sort of
here now,
picked it.
Paul.
There you go. All right.
That's the whole point, I think, right, of the show is that Paul's a perfect example of, he's at that age range.
I didn't know what I was doing. That's the example you're trying to say. I
Yeah.
just suddenly I had to make a choice, and I didn't really know how to make the choice.
Well, that's my point, right, is that's why you have professionals, right, that know what they're doing. It's like with hospice with us. There's so many questions families have, right?
100%, yes.
I have a social worker that can answer family dynamics. I have my wife in the office who handles a lot of the pre-authorizations, right? We have a director of nurse that handles clinical, right?
Sure.
There's different people for different reasons. That's why you have a
Yes,
team, right?
absolutely.
And so just like Paul right now has a lot of questions about Medi-Cal, Medicaid, what is,
Medicare Advantage.
and
really, all
Medicare
that-
Advantage,
all
what
that
is,
stuff.
all these questions you have. That's why there's professionals like you, right? Call Miriam,
Correct.
right? Like that, set an appointment, right?
Yeah, we can totally do that. It can be over the phone, it can be in person. And just to clear the difference between Medicare Advantage that you continue to mention, Paul, and Medicare Supplement.
Right.
The Medicare Supplement.
That's the key. Those are the two key.
Yes,
phrases.
sir. Those are the two you're talking about. The Medicare Supplement comes with possible underwriting. They need to know, of course, your age and your zip code, right? Those come with an additional premium on top of Medicare Part B premium, and you must purchase a prescription drug plan as well to avoid any late enrollment penalties. So to throw more things at you, gosh, yes, it is confusing. There could be penalties, but this is why you really want to connect with a licensed insurance agent like us at Mint Health Insurance that can help you simplify and identify what works best for
Because
you.
you triggered my memory. That was the choice I had to make. If I got it now, I'm automatically qualified for a Medicare, whatever it's called, supplement plan.
Correct, because you just turned 65.
I don't have to go through underwriting.
You don't have to.
But later on, if I want to switch back to that, I got to get. Maybe I've gotten sick, and I don't. And
Yep.
they won't let
Yep.
me qualify. So there was a choice.
Correct.
And that meant you could go to any doctor, anywhere, all this kind of. But that was at a cost. That was at a premium.
That
where
is
the
correct.
Advantage plans were free.
I always say freedom comes with the price tag.
There you
But
go.
it is important to know. Maybe it's something you have saved for. It's within your budget, right?
need.
Maybe it's not. But guess what? There are Medicare Advantage plans that actually have very good networks. I'm not going to share any special medical
No, we're
groups
not how to
because
pick winners or losers.
yeah,
but there's a difference.
but there are.
So my point is, I'll emphasize it again. I didn't have anybody to go to. Hopefully, I didn't make a bad choice by just sticking with what I already knew. But I wish I knew somebody like Miriam that I could have called up and said, "What do you think? Give me understanding," because it is confusing, folks. It
It
ain't
sure
easy.
is.
And if you don't do it, here's the other one that my wife learned the hard way. She was working at 65.
Mm-hmm.
She said, "I got insurance from a bank she worked for. I don't need Medicare."
Correct.
So she didn't sign up for it. She signed up like 2 years later and got a penalty.
That's exactly what I said a couple minutes ago.
What?
But guess what? She could have disputed that penalty if she would have proved that she had credible coverage from her employer. So once again, reach out to us.
Didn't know
We're
that.
here to help. Well,
Yeah, because now this
sharing that
penalty
with you now.
is with her for the rest of her life.
It's there forever.
I think
Yes,
the other
sir.
important thing to remember is things are always changing. Things are always evolving.
Every year.
From a government standpoint, right? So as those laws or regulations or rules are changing, you have to remember with the changes, the professionals are being updated.
Every year.
I've had guests on the show, from different mortgages, lending, and all this, and how banking is, everything changes, right? Regulations and different grants and different loans. It's the same thing in every industry. Things are evolving. And as regular general public, we're not always updated on every industry. And that is why you are the professional in that industry. And you're keeping up to date with all the changes, right?
Every year we go through certifications with each plan that we represent, which brings me to a lot of the new rules here, right? Anytime you get a call from anybody offering Medicare, that's illegal. You shouldn't be called. If you would like information, you're supposed to initiate that call. Okay. So when people are calling you that way, be careful. You don't know if they're truly a licensed agent or they're trying to fish for information. So please be aware of that. Medicare does not come to your house. They do not call you. So keep that in mind.
Well, not only that, but nowadays you have to be careful when you're sharing very key important information like your name, your date of birth, all connected together, right?
And saying yes.
Your social security number and your Medicare number, whatever that is assigned to you. Because with those simple 2-3 things, they can gather a lot of your information. And it can be dangerous, right? Today, data is so important, right?
Yeah,
How we protect it.
A lot of the times they record things and they can probably even manipulate it the way they look for, right? So just be very aware. Do not take unsolicited calls and make sure you reach out to us, your trusted local insurance agents.
So real quick, again, let's remind everybody, grand opening next Wednesday, free event. There will be food. There'll be some cool swag bags
Of
for the
course.
first 65 people
Yes.
that attend. So get there early. Can we give out the address? Is that okay?
Absolutely, yes.
What's
Let's
the
go ahead
address?
and share it.
We're going to give out the address here, and also, of course, just remember that this is also a great networking opportunity.
It
right?
sure is.
Because you're going to go, and even if you're from Orange County, why not go to Menifee in the Inland Empire? You're going to go network with new people out there. I know you're very well connected out there. So
Thank
it's
you.
a good synergy.
It's a pleasure. Yes, there will be lots of networking as well.
And you
Yes.
can
So-
make it a day and go down to the wineries. Or
Why
the-
not, right? That's what I've actually encouraged some of our friends to do. Spend the night, we'll go to the winery the next day. Why not? So the address for our grand opening at Mint Health Insurance is 28230 Bradley Road in the city of Menifee. Once again, that is 28230 Bradley Road in the city of Menifee, 92586. And for more information, you guys can find us on Mint Health Insurance on Instagram, Facebook, and LinkedIn. We will be posting, like I said, the link, the invitation, and just a lot of the cool events that we're going to be having throughout the annual election period. That once again begins October 15th. It ends December 7th. A reminder, end of Medicare annual election period, my husband's birthday, and your awesome toy drive.
Yes, our annual tour drive, December 7th, which
Yes,
is coming
sir.
up. It's crazy how fast time flies. We just
Sure
had our
is.
annual golf tournament, right, a couple of days ago, and we're like, wow, December's almost here. It's just one thing after the other, right? We're just celebrating all these Hispanic Heritage Months stuff going on, and it's like December's around the corner. So, I encourage everybody listening that, we go out, network, Mint Health Insurance, Miriam Ramos. Is that what it's under Instagram? Miriam Ramos?
No, it's actually under Mint Health Insurance.
Okay, under
Yes.
Mint. So if you have Instagram or Facebook, like you said,
LinkedIn.
or LinkedIn, definitely connect with her, because let me tell you something, folks. May not be for you because you're like, well, what does this have to do with me?
Exactly.
But you have a mom, a dad, a tío, a tía. There's somebody in your family who's around that 65 year of age who needs this information, right?
Absolutely.
And you should be the person to be able to raise your hand and say, Mom, Dad, or Tia or Tío, I have somebody that I'm going to connect you with who's a professional in this area, because there's nothing worse, than feeling like your loved one got taken advantage of, right?
Absolutely, or you have no answers or nowhere to go. And as a reminder, actually, we have a national footprint. So any state we can assist with enrollment, with any questions, and just to help and guide. But of course, a local footprint here in the Inland Empire, the Orange County, LA County, San Diego County, Imperial County. We have agents ready to go out, help you, whether it's over the phone, virtually, telephonically, through Zoom, whatever works best.
How long does it take when let's say somebody like a Paul Roberts wanted to switch their benefits or get some sort of, is it something that's very,
Yeah,
easy
so
to do?
usually, like I said, we like to assess your specific needs, right? We first ask for the list of your medications because that's very important, guys. A lot of the plans upcoming might have deductibles where that did not exist for us.
And meds
this
are so
year.
expensive, right, nowadays.
Exactly.
Medications, yeah.
There are some plans that will actually be covering brand name medications at no cost until person reaches something called the donut hole or the coverage gap. So we'll get into those things at our appointment. But it takes about an hour, I would say, from assessing their needs, checking their doctors or medications, talking about, like you said, are you looking for a plan that gives you more coverage on hearing aids? Are you looking for transportation?
I'm sorry I didn't hear that last part.
Of course, it never fails.
For
Hearing
those of you
aids,
watching Facebook,
dental.
Paul over here is having problems listening. I think because he's hitting his 67th mark. Is that where you're at?
Something about hearing aids, she said.
Yes.
That's all I know. I didn't hear
Yes.
that part.
That is correct. Some of these plans offer these things, John, and this is obviously public knowledge.
As a free something, like the hearing aids, or just
Not necessarily
or discounted or something.
at a certain specific rate,
Okay.
right? But it's actually something that's available.
So there's a difference between these plans. That's what
There
you're
is
trying
a
to say.
difference.
Don't just think they're all the same.
They are
Yes.
not. And this is
Yeah.
what we do. We come to you, we put all your information in our profile, and then it automatically just gives us the top rated plans based on your needs. We go over those with you. We allow you to compare. We give you a sheet if you're one of those like me that likes to have a visual. And if you're on the other side of the phone or virtually, we email that quote to you or even text it. I mean, technology has made this so much easier for us. And when we have those answers in front of us, we're able to select that plan that works best for you.
One quick question.
Paul has another question. He keeps going like
I
this.
love it.
And I keep doing this. I'm like, no, Paul,
No,
that's it.
that's
We're
over.
running out of time.
If we come to the thing, what is it, next Wednesday?
It's
Yes.
next Wednesday. Yes, sir.
Do we have to dress in mint?
You know, I almost made it a requirement, but no.
I only wear orange.
We
This is
embrace
Orange County Talk Radio.
come in orange, please. You'll match with my wall. So we embrace individuality and we embrace being able to service everybody, which brings me to something, Paul. Thank you for the reminder. We are beyond proud to share that we will be having an American Sign Language translator at the ribbon cutting.
Nice.
Because we want to be inclusive. Like you said, don't leave anybody out. We
Yes.
all need help. We all need guidance. This is why I started this. Started with my grandmother. Now we're here. So we're here to help, guys.
So it started with your
Please take
grandmother?
advantage. It started with my grandmother, yes, sir.
That is great.
But we'll leave that for another show. It's 12:29, and I
No.
think everybody's got to go.
No, Paul kept asking questions,
So
and he
you bought
took
a
my
couple more
time.
minutes?
So
Okay.
he owes me about 5 minutes. I'm just kidding. I'm just kidding. No, you know what? Again, let's remind everybody, next Wednesday, grand opening, right? 4 to 7, 5:30 will be the ribbon cutting. Come out and support Mint Health Insurance. Miriam Ramos, who is, of course, the founder, which started with the whole grandma story, which is
Yes.
great. We'll talk about that one day. And of course, to your husband, congratulations on, what a great partnership, what a great business.
Couldn't agree more. Thank you so much, John. Do you mind if we share the number for those that can't
Sure.
access?
And a website
Yes.
too.
Yeah.
Sure thing. So
Email
our phone
website.
number, you can reach us out for any questions or even for directions to Menifee.
Yeah.
It is 1-888-225-MINT.
One
Okay.
more time.
1-888-225-6468. And you can find us at minthealthinsurance.com.
And if they wanted to email you, what's an easy email for you?
The best email, let's email the husband, right? Let's
Put it on
blow
him.
up his inbox. Let's
Oh,
do
wow.
a Vega at mint65.com.
Okay.
or you can email me. Of course, I'll be more than happy to answer emails at miriam@mint65.com.
Perfect. That's important, right? Because not everybody may want to pick up the phone or just wants to email you. But, again, go out and support this grand opening, this ribbon cutting in Menifee. Even if you're in Orange County, let's get out there. Good opportunity to network, connect with people out there. We do a lot of partnership with the Inland Empire. We do a lot of events together, and it's all about collaboration. And of course, we brought you on because, you supported our annual toy drive last year, which we really appreciate.
And we will continue to, of course.
Yes.
It's a pleasure.
December 7th is our annual toy drive. Don't forget, folks, we're actually going to have a great performance this year by Trinier, which is a legendary band or group. Many of you may know the music, may not, but just Google it. But we're excited about it again this year. And thank you for being here. Before we go, I just want to remind everybody again, it's Hispanic Heritage Month. And the podcast today has been brought to you by our friends at Farmers and Merchants Bank. Again, thank you, Farmers and Merchant Bank, for supporting us on Hispanic Heritage Month. And Mr. Paul Roberts, thank you so much for always putting up with me here at the studios. You had some great questions today because, hey, we're all dealing with this, whether it's ourselves or our parents. It's important to get informed.
And we're not ready for it. That's the whole thing that
Exactly.
struck me. Nobody called me up and people started hitting it with the pamphlets and email and stuff. But I really didn't know what I was getting into.
Yeah.
And suddenly I had to make a choice by a certain date.
Exactly.
Maybe
Yeah, you have an enrollment period of only 7 months, guys. 3 months prior to the 65th birthday, the 65th birth month,
Right.
and up to 3 months after to avoid those penalties, right? So once again, thank you, John. Thank you, Mr. Paul. And thank you, OC Talk Radio, for having us on today.
And thank you to the Orange County Hispanic Chamber of Commerce. Again, thank you for all of our listeners and our viewers for listening to our community podcast show, where our community is your community. Take it away, Paul.
Well, there you have it. That is really good information. If you're like me, at or around 65, take advantage of this free offer. Don't just go check them out. That'd be great. Go and call them and learn more. Always a reason to tune in each and every time to meet our community here in Orange County's only community radio station, OC Talk Radio. Streaming live from our studios here at the University of California Irvine Spiel Lawn Innovation Center.